what we like to do here on the Highwire is get someone that might actually know what they're talking about. How about somebody that used to work for Pfizer? How about somebody that used to be a vice president at Pfizer? You know, looking at immunology and virology, of course, I'm talking about Dr. Mike Yeadon. This is a man we've talked a lot about. Let's just look at his resume for a second, shall we? Senior Principal Scientist of the Wellcome Research from 88 to 95, Chief Scientific Officer, Allergy and Respiratory Research, Pfizer R&D, Vice President of Allergy and Respiratory Head Research, Pfizer Global R&D, CSO and VP Allergy and Respiratory Research Head, Pfizer Global R&D, Consultant Scientific Advisory Board for Pulmatrix, Consultant Apellis Pharmaceuticals, co-founder of Xiarco. Obviously, this guy knows a little bit about the pharmaceutical industry. He knows a lot about Pfizer. He knows a lot about vaccines. So why is it that for the last, I think, over 6 months, we've reported that Dr. Michael Yeadon is trying to be heard by his peers when he's saying, can we all just take a look at this thing for a second? Can we take a look at PCR tests and say maybe this isn't decent science? Can we take a look at these lockdowns and see if they're necessary? Can we take a look at this disease? Can we please take a look at this vaccine that isn't going through a proper safety trial? Nobody seems to be listening. Today, hopefully, we're going to change that. I'm joined, and it is my honor to be joined by Dr. Mike Yeadon right now. Dr. Yeadon, thank you very much for taking the time.
Thank you very much for having me on your show. I've admired it for quite some time, and my views on the situation we're in have hardened. And I just watched the clip, well, the section on the Romney family, and I finished it. I would say the combination of two emotions. One is incandescent fury and sorrow. And if I can help this evening, to share scientifically information that will help, your audience avoid being in that position, then that makes all that I'm doing worthwhile.
Okay, so take me to the beginning. At least the beginning of this pandemic is taking place. You have this almost legendary background with Pfizer, with working with vaccines, R&D. You're well aware of this issue. You obviously study disease, and you have for decades. This is your wheelhouse. What's the moment in this pandemic that you get triggered, where you're just thinking, there's something really wrong here? Where did that start inside of Dr. Yeadon?
Yeah. So yes, just in terms of background, I've always been someone who likes tinkering with concepts, science, machinery. I always like to try and understand how things work, when they're broken, why they've gone wrong, and what can I do to fix it. That's kind of the whole approach to thinking about science and everything, really. And so early on in 2020, we were told there was this new virus emerging from China. And I was I believed what the media was telling me, because, I'm a normal kind of middle-class guy. I expect my national broadcaster to largely tell the truth. And so when they got to the point of telling us that we needed to lock down, this was, I guess, in March 2020 in the UK, I remember feeling this is just really strange. I mean, okay, how bad is this that we've got to lock down, and will it work anyway? So I started in the first 3 weeks. We were told 3 weeks to flatten the curve. I don't know if anyone has a hollow laugh at 3 weeks to flatten the curve, but we do. But anyway, after the 3 weeks, two things happened. One is the peak of daily deaths had clearly passed in the UK. We could see it falling, and I expected to do that. We could talk about why I was confident. And so I was shocked when the government, after 3 weeks, said, we're going to extend this lockdown. And that my wife tells me I was raving, running around the house thinking, there's something seriously wrong. The Swedes have got it right. What the hell is going on? Because at that point, I'd done enough thinking to be absolutely certain that lockdowns couldn't possibly work. And I may be a big claim, but I can explain. It's very easy.
Please, right there. Please do. Please, let's right there. Why wouldn't lockdowns work?
Yeah. So let me just take a step back. I think it's a few things I want to just communicate in case I forget them in the heat
Okay.
of the moment. I want people not to be frightened of this virus. And as I go through what I'm going to say, I hope, far from it being a shocking statement, surely we should be frightened. It's terrifying. Don't be frightened of the virus. I'm afraid everything our governments and their scientific advisors have told us for a year and a half are all lies. All lies. They're not just a little bit wrong. It's not a matter of opinion. I'm going to just take you through the evidence that says the people who are advising my government I respect as professionals. That means they know everything I know. So when I conclude it's definitely not true, item X, and we'll go through these items, that means I know they know that too. And that means they're telling untruths deliberately, and we call that lying. So it's not a frightening virus. We're lied to about absolutely everything. I think the objective is to make us receptive to the vaccines, and we should talk about those. And then lastly, where the hell is this all going? Now, I'll lead you through my evidence and where that's pointing. Because as I say to my wife when she says what's happening next, I always joke and say it's not my crime. Because I think there's a serious crimes going on. But let me just take your initial viewpoint. So let me just start where I was though. I don't want people to be frightened of this virus. The reason I'll point to some data that one of the most esteemed epidemiologists, Dr. John Ioannidis, working at Stanford in America, has been tracking this this infection around the world for over a year. And he's recognized by the WHO. He'll often have his reports on the WHO website. When you look at the global infection fatality ratio, it's a measure of how dangerous is this virus. It turns out it's a little bit more than seasonal influenza. A typical seasonal influenza kills 1 in 1,000 people, nearly always people at the end of their lives who are vulnerable and old and ill. And SARS-CoV-2, it's about 0.14, 0.15. So it is a little bit worse, but it's in the same ballpark. I would say it's not worse than bad seasonal influenzas, but worse than the average. So, and yet that's not the impression you're given. The governments give us the impression, and all of their policy responses give you the impression that this is something like as nothing has been as bad as this since, say, the First World War, the 1918 flu, and it's simply not true. And then we'll come back to this. There are some really good treatments for this infection. That's one of the things as a drug discoverer, it makes me very angry that good treatments that are well evidenced have been hidden from us, and sick people have been deprived of excellent, safe therapy in order to continue people's fear. Unfortunately, that's the situation. So it's not that dangerous a virus unless you are very close to the end of life, very frail, and usually also ill. But let me just move through then the things that I assert are lies. But that's first. We are given to understand this is a terrifying virus, and I've just told you that the best epidemiologist in the world has assessed the situation and said it's a little worse than typical flu. It's in the range of flu. That's a big deal. The next thing they told us is, well, they implied or told us that there are no treatments, and that's simply not true. That we know that over the last year and a bit, lots of physicians, and I've got to know one, Dr. Peter McCulloch in the States, really passionate physician, and he just refused to accept what he calls treatment nihilism. If you get sick, you just phone the hospital and they just stay at home, and only if you get so sick that you can't cope, then come to the hospital, and then we'll start to treat you. And he, like other doctors, said, well, we know how to do some things for viral replication, for inflammation. Why aren't we trying stuff? And so he and others, and I would call out Pierre Corey, Zev Zelenko, and trying to remember, Didier Raoult in France. So they have tested and proven that things like hydroxychloroquine used early in infection can reduce viral replication. That later, or at any stage actually in the disease, you could use ivermectin, and it's clearly reduces inflammation in the lungs. If you do get inflammation, then this is right back in my area of allergy and respiratory, good old inhaled steroids used for asthma and COPD. Inhaled budesonide is excellent at reducing inflammation. And then the end stage disease, if you're really unlucky, you can get blood clots, and we'll come back, Del, to why that is with this particular virus. And there are some good anti-inflammatories. So there are maybe four really good drugs. And had these been made available, then honestly, I think we'd have been through this in a couple of months. So you've got to ask yourself, and all the time I was dialing up, why is what's happening? This makes no sense. So I did notice that, as you mentioned, early in the summer, I started looking at what they were doing for diagnostics, and they were using this PCR test. I'm sure you've talked about it on your program. It's a very powerful technique, but it's not a good technique for diagnosing viral infections, as the inventor, Kary Mullis, who won a Nobel Prize for its invention, told us repeatedly. It's good at detecting things, a piece of DNA or RNA. But I noticed that I could see that they were being sneaky. The people working in the UK, they refused to disclose how many cycles they were using. They refused to use an internal standard, and they claimed they didn't have samples of the virus. So I just thought, how can you not have an internal standard? Just for people who don't know, if you're using a diagnostic test, then you should always want to you should use some of the thing you're trying to detect and put it into the test and show that it can detect it. And then you can use that method to work out where to position the standard curve, as it were, when you try and test a clinical sample. And all I could see is they were not using these standards, and they were using as much amplification as the machines would use, rather than the amount that you should use to work out if infection was present. And by the summer, I was absolutely certain they were turning up the amps to 11, over amplifying it, not using internal standards. What else was there?
So let me just jump in here really quick for my audience that maybe knew some are a little bit more educated. What we're talking about, running these cycles here in America, New York Times, we did an investigation in PCR tests. We found here in America that every lab apparently was running about 45 cycles on these PCR tests. My understanding is even Tony Fauci himself said, I think it's beyond 22 cycles. Odds are that there's no infective material, or maybe 26 cycles somewhere in there. But really, you start this major decline from a reality of an infection right around 10 cycles is where, you start really seeing this steep decline in the quality of the information that you're getting. So and maybe you can clarify, I'm sure you're the specialist, but for people listening, you imagine, I always just say it's like a microscope, you just keep turning it and going deeper and deeper in. Eventually, you can be looking at something so, a dead fragment cell that you ran into. It doesn't mean your body is infected with it, but at 45 cycles, the amplification is so gigantic, anything looks like a problem.
Yes, it's exactly right. So certainly by about this time last year, some very assiduous workers had tested, I think, hundreds of people who had SARS-CoV-2, and they'd worked out the relationship between symptoms, the number of cycles of this test before you could detect whether they had the virus present or not. And here's a really important thing: whether they could culture the virus, grow the virus on, shall we say, in cells. And they found that when you got a positive test beyond about 25 cycles, it became more and more difficult to be able to infect some cells in a culture dish. In other words, there wasn't enough live virus there to deliberately infect a culture dish when you're trying to infect. So I drew the line and thought, well, okay, if you're over about 25 cycles, if it takes more cycles than that to show some presence of little snippets of this virus, then there's not enough virus there to make you infectious at all. And that number seems to be in the mid 20s. No one's really sure, but mid 20s perhaps. But as you say, in the UK, I think they were using 39 cycles, and as you say, I've heard over 40. Each cycle doubles the amount of material roughly in this test. And so they were multiplying up, believe it or not, I did the maths, it was about 1 trillion fold. And so, as the inventor said, the lower limit of detection is one molecule. Now, one molecule, theoretically, it could literally be wafting around the room I'm sitting in. Couldn't possibly make me ill. But if you run very high cycles in PCR, you can end up with a false positive, really. You end up with a test that you declare positive, but you've used such cheating circumstances, contrived circumstances, that you wouldn't rely on it. What it doesn't do is tell you that the person's clinically ill, and it doesn't tell you that they're infectious. And isn't that what we want to know? Am I ill?
I mean, I have to imagine the moment,
breathe?
someone as educated as you, the moment you recognize that this is what's happening, the first question you must have had, which is, why would they be artificially inflating an infection rate and causing panic around? What would be the possible need for that? Wouldn't your goal be to say, let's be really accurate about this so we can wipe it out, figure out who's actually got it, instead of creating a bunch of false and fake cases by the tens of hundreds of thousands, millions around the world?
Yeah, no, exactly. So that you were right to put up that paper. I think that was the third of 3 or third of 4 papers I wrote. So I really focused on testing last year.
Yeah.
I didn't really pay much attention to, how severe is this virus? What are the treatments? Asymptomatic transmission, masks, variants. But I'm just going to come back to all of these. So
Yeah.
I was convinced by mid-year that there was bad actors operating at least in the testing side, that would produce a scare story, that there were more cases than there really were. And I didn't know at the time. I didn't have like a synthesized opinion as to what was happening. To be honest, I thought it was first like a financial reset. It was, let's keep us all locked down while we pretend there's a worse virus than there is, and something will happen. That's probably as sophisticated as it was. But when we got later in the year, I'm afraid I came to the conclusion, it's a big claim what I'm going to say, but it's literally every single one of the central narrative points that your government and mine tells you about this virus and what you should do, they're all lies. So we've talked about the exaggerated severity. That makes people very scared. Mm-hmm. You don't tell them about the treatments, which is just dreadful. People have died in my country, tens of thousands, I think, have died, who probably could have been saved. So I will accuse right now the scientific advisors to my government and senior ministers of mass murder. I want to see you guys in the dock, because that's what you've done. So where else have they been lying? So we've talked about, yes, the severity, lack of treatments, and over-testing. So as Ted Ross of the WHO, this test. By the way, Dan, I was one of, I think, maybe 20 authors that wrote a critique of this PCR test, Professor Drosten in Berlin, who invented this test. So anyway, we criticized that test because it was obvious from the off that it was designed in such a loose way that when it was interpreted and adopted around the world, almost everybody would end up with an inaccurate test that would very often show positive even when there was nothing there. And I think that was deliberate. So this Drosten guy, I'm afraid he's part of it. So, but then it was worse than that. Let me just get this right. Yeah, the thing that really triggered me in the middle of the year was when I was told that people without symptoms can be a respiratory viral threat, a respiratory health threat to other people. Now, I knew that wasn't true. Remember, this is my area. I've worked in pulmonary disease for 32 years in total. And I knew, and I can explain to your listeners, they'll know when I explain this that I'm right, and therefore they're being lied to, I hope. It's a big switch, by the way, for those of you who think your government has been telling you the truth. When you realize they haven't, it's a horrible shock. So why am I confident that this so-called asymptomatic transmission is a lie? In order to be a good source of infection, you need to have a lot of virus in your airway. If you only have a little bit of virus, you really can't breathe it on people. The chances that you'll be able to infect someone else is very low. So the more virus you've got, the better the source of infection. That your mother could tell you that, blow your nose and don't cough on people. This is the basis of it. So, but people, here's a critical point. People with lots of virus in their airways will have symptoms. No question, no arguments. Why? That's because the virus is attacking the lining cells of your lungs. That's what it does. It burns through like a moss fire under the ground. So it's infected you, and it's infecting one cell, then another. And your body doesn't like that, and you will feel that. But the other thing is your immune system, if you're immunocompetent, will be attacking the hell out of the virus, and you'll feel that too. So if you've got lots of virus, you will have symptoms. You will have symptoms. That means people without symptoms can't have much virus. That's true. And that means people without symptoms can't infect other people. And so this is theoretical. I knew that would be theoretically right. And there's been lots of literature. And there's one really big study. And what they did is they compared hundreds of people, or they followed hundreds of people who were PCR positive, and they split them into two groups. If they were PCR positive with symptoms, like a typical person who's got a bad respiratory infection, they found they infected another household member about 18% of the time. So it's not as much as you would think. And partly that's because there was a lot of prior immunity in the population. We'll probably come back to that. But people who were PCR positive but had no symptoms, less than 1% of them managed to infect a household member. This is someone you're intimate with, you live with them, less than 0.7. Well, the false positive rate of PCR has never been determined, but I'm confident it's probably 0.7% or a little bit higher. I don't think people without symptoms can infect anybody, not at all. But for the whole 15, 18 months in my country, we've been told every day by lying adverts from the media. I blame the media as well a lot. They're absolutely dreadful. Liars. They've damaged their own society for their own lives and children as well. They've lied every day, and they've said 1 in 3 of us have got the virus and are spreading it without knowing. It's just an utter lie, and I've described how it's impossible, and it's been shown not to be possible.
Well, and it's the whole masking, right? I mean, the masking, just to be clear for everybody, if we had treated this like every other virus, if you didn't have a symptom, you go to work, right? If you're healthy, go to work, go to play, run in a track meet. We were wearing masks, and as Fauci is clearly now being outed in his emails, he knows you can't stop the breathing in of the virus. If it's in the air, it's going to come right through the mask because it's such a smaller micron than your average store mask, you know. So he said the only thing it might do is maybe stop some water droplets if you're sick, but the whole reason all of the healthy people in the world are wearing these apparently is because we are potentially asymptomatic carriers. If they admitted that asymptomatic does not spread this disease, there's no need for all these healthy people to be wearing masks and obviously raising the ability for their immune system get beat down so that they might catch this by breathing their own, you know, CO2 and sweat and touching their face and all those other issues.
But Del, I think, because I was listening to some psychologists talking several times actually, and they believe that the reason for masks, the lie about masks, making everybody wear them, where you cannot possibly be infecting others if you're perfectly well. So it's clearly not appropriate and definitely harmful. But one of the things that's harmful is when you look around and you detect other people are wearing masks, what does your hindbrain, your lizard brain tell you? Hazard, risk, threat, frightening. And so basically it amps up people's fear. And I think that's been the main reason. It's to make people frightened, and it fits with the other lies that they've been telling you. But I'm afraid you can even find Dr. Tony Fauci and I think a senior WHO physician, both telling us that it's never an asymptomatic person that drives the epidemic. I think they both said exactly that phrase in about January or February. They said, if you're symptomatic, you can transmit. It's never someone without symptoms that drives the epidemic. I'm sure I heard Fauci and WHO said that. So you can go and find those because I've seen them recently. And then they changed the tune, and they've spent the last 15 months lying to absolutely everybody. So what else? What else about masks? Oh, yes. So you can't, I realized, and I didn't join the dots because I was too slow. I realized probably in about May last year that lockdown couldn't work. And I'm going to describe it because I've heard no one else describe the reason it can't work. I've heard lots of people say, well, this is a disease transmitted from one person to another. So if we reduce the number of contacts by lockdown, you must slow transmission. I've heard people be really insulting and saying, what part of that don't you understand? And I remember thinking that's a category error. It's not to do with number of human contacts. It's number of infectious contacts. And remember what we've just discussed. If you're not symptomatic, you can't represent an infectious contact for somebody else. Now let's step back and ask yourself, who goes outside, who goes to work, who goes to the store, goes to the gas station, walking on the sidewalk? Generally people who feel pretty fit and well. People who've got a serious respiratory virus like influenza or COVID-19, you don't generally go out. Why? Because you're ill. People with symptoms are ill and they feel unwell. And they can feel so unwell they're in bed, and if they're very badly affected, they could be in the hospital. They're not wandering around for you to encounter them. Now, if that's true, that means not very many transmission encounters, infection encounters occurred in the community. So when you smash it, close businesses, tell people to stay at home, of course it doesn't make any difference to transmission, because that wasn't where it was occurring. It can't be occurring there, because you would have to wander into almost a zombie, someone who's really sick and still wandering around in your face. And then I've got something else to describe. And again, I think I'm the only person who's joined these dots. If we think back to when human beings lived in caves or an aggressive external environment, we realized one of the things that could kill you during winter, if you live in the temperate zone where there are seasonal respiratory viruses, is fit, healthy guy going out to kill a mastodon or whatever. If you caught a respiratory virus from someone, you could be so disabled for a few days, you could die. Someone could beat you up, you could be eaten by a saber-toothed tiger, you could just starve. So I think for hundreds of thousands of years, as we developed, we've realized that a respiratory viral threat is really quite a serious thing. And I think what that helps you do, and you don't even notice, when you're walking along the sidewalk or along a corridor, you scan somebody and you check whether they look physically well or not. And if they don't, you immediately have a flag come up and you try and assess why are they unwell? Are they staggering like drunk, or are they old and shuffling? But if it's someone like 30, 40 and they're coughing and they're bent over, you instinctively think this person could infect me with a cold or a virus. And what you do is you give them 2 meters, without even thinking about it. So what I'm saying is, I don't think infection occurred much in the general community at all. And because symptomatic people who are good at infecting you, who have lots of virus, are symptomatic, they will be ill. And if they did stagger out anyway because they had to, you would generally spot them and give them a wide berth. So statistically, I think the number of times infection occurred in the general community was so low as to be, irrelevant. And therefore, business closures, stay-at-home orders made no difference to transmission, because that was not where it was occurring. Where was it occurring? Occurs where there are people with symptoms and people who are susceptible. The places where that occurs is hospitals. The medical staff, or the cleaners, the service staff, and the patients are trapped together, and symptomatic patients, unfortunately, could infect other people. Guess what? That was where it was occurring. And also care homes, where there are residents that stay there for a long time, and a little bit in the domestic home. Not very much, because the domestic home, the size of the family unit is relatively small. And so quite often you'd find one person would catch the virus and nobody else, because there was a lot of prior immunity, or a child in the family that wouldn't get symptomatic and they can't spread it either. So I believe that, like 90% plus of the transmission happened in institutions. By the way, that's what happened with SARS-1 in 2003. It's a disease of institutions. That's what happened with MERS in 2012. It's a disease of institutions. So I believe SARS-CoV-2 is largely a disease of institutions. Your government has lied to you. Lockdowns could never have worked because transmission did not occur in the community, but in institutions. And so that's pretty much, that's my list of lies. Absolutely every
Pretty big
part
list of
the
lies there you go, Dr. Yeadon.
I've actually challenged people. I've said, if I'm wrong in any one of these things, please correct me, because I want to improve. But they can't correct all 6. Exaggeration about the lethality, the lack of treatments. The other one was this is a novel virus.
Right.
And because it's novel, no one will have any immunity. And it frightened the world. And I remember, I think in the first 3 weeks, I worked out that was not true, because I looked on GenBank, I looked at the sequence, I realized it was something like 80% similar to SARS 2003, and maybe 60% similar to common cold causing coronaviruses. And I thought, phew, we're going to be okay. I figured there'd be a lot of people who've been exposed to one or other of those. I knew immunology is my strongest suit in this game. And I knew that meant lots of people would have prior immunity. That is, they'd encountered something similar, they had overcome the virus, and with stable respiratory viruses, if you overcome them, you will be left with very durable, strong immunity, T cell and antibody. And I knew that. And I know that the scientific advisors of your government and mine know that too, because they are my peers. They, people who advise the UK government. One of them is Sir Patrick Vallance, and just by amazing coincidence, 32 years ago, he and I worked in the same laboratory at the Wellcome Research Labs. He was a young medic, he was doing a PhD. I just finished my PhD and was just starting to run my own lab. Clever guy. But my point in mentioning that is he and I had a common educational thread in the UK academic setting at the same time. Guess what? We had the same set textbooks. So Ivan Reut wrote the famous Essential Immunology. I bet you Sir Patrick Vallance had a copy of that. I certainly still have a copy. What I know is, because we had this common training at the same time in the same institutions and the same set texts, the foundational knowledge I've built on and he's built on, they're the same. So if I know something, I'm not a genius, I'm just well worked in my area. I think he knows what I know. I'm absolutely confident that if there was no political heat in this, that we could have a nice dinner and a glass of wine and we'd go through all of these and he would concede every one of my points because they're so obvious scientifically. But unfortunately, he and a load of other people on the scientific advisory groups have flatly lied repeatedly. They've exaggerated and lied, and I think it's to frighten people. And just back to the virus being novel and therefore no immunity, I'm sure you've looked at this, and I certainly have read more papers in immunology in the last year and a half than in the last 30 years. So some really, really brilliant cutting edge science has been done. And there's one thing I'm going to mention, that some clever person, I won't mention them, but I reckon they were on this in early January, that they went and they found some people who'd been exposed to SARS in 2003. I now know what they were doing. Very clever. And they asked these people who had survived, will you volunteer to donate some blood? Because we want to find out if your immunity, do you have immunity? And if so, what kind and so on. So they gave consent to give a blood sample. And they found that every single one of the people who'd survived that virus 17 years earlier, this work done in 2020, every single one of them had striking T-cell immunity to SARS. So they would take their blood, they would extract these so-called T cells, stick them to a plate or put them in a culture, and they would add a peptide that they knew, a piece of protein that would represent part of the virus they had survived 17 years ago. And they ask if the cells become violently activated. That shows that these are memory cells that recognize this encounter. And they did, they all did. So they all had robust T-cell immunity 17 years later. It's probably going to be lifelong, isn't it? Well, I think that's what's going to happen with SARS-CoV-2. And so far, they've looked out to about a year, and that's what they're seeing. Right. But the other thing that was miraculous, really clever immunologist, and I smile as I remember it, they didn't just give the donors cells SARS to see if they had immunity, also gave them cultures from sick people, SARS-CoV-2. Every single one of them also recognized SARS-CoV-2. Now, these two viruses, the 2003 SARS and this current one, SARS-CoV-2, they differ by, I think it's 20% or 22%. So that means they're 80% similar. It's probably not that much of a surprise, really, is it? If your body has memorized this encounter with all of the virus, what you do is you take high resolution biological photographs, as it were. You break it into pieces and you memorize images of these pieces of this broken virus that you've smashed up. If you encounter something that's 80% similar, you have loads of your cells will recognize that. Basically, you think, oh, I've met this guy's cousin before and I've beaten him then, and I've got the tools, guns and ammo, and I'll beat him again. And that's exactly what happens. But this is a really important thing. Just remember, and people can go and look that paper up, the SARS, people who have memory immunity to SARS 17 years ago, they do recognize the new virus. So let's just say this gap is 20% between these two viruses, and the human immune system easily bridges that gap. If you're immune to one of them, you're immune to the other one because of the way immunity works. So now I'm going to come to the next lie, which is the lie of 2021, variants. Now, it is true that when this virus replicates, it makes mistakes. It's about 30,000 genetic units long, so it's quite a big thing. I think it's the biggest virus ever isolated. And every time it replicates, it makes a copy of itself in your cells. Every now and again, it makes a typographical error. It gets one of the bases wrong, or 3 of the bases wrong, or 10 of them wrong. And if that virus then grows up and is used to infect someone else, and you sequence it and it's slightly different from the original, we call that a variant. That's all it is. It's just a typo. But there's so much talk about it, the Brazilian variant, South African, the Kent variant, and the Indian variant. People probably get this impression that they're, really quite importantly different, right? Otherwise, why would the advisors and the governments and the media be, giving you this big deal about, about the variants? I've looked it up and no one has contradicted me. So if I'm wrong, you can contradict me after the show. If you find the variant that's most different from the Wuhan strain, it's 0.3% different. In other words, 99.7% similar or more. So I've just told you that 2 viruses that differ by 20% the human immune system, that's absolutely no difficulty in realizing that they're both crooks. If you've beaten one of them, you recognize the couple of the other ones, cope and so on. So there's no chance whatsoever. It's not possible that a variant can escape human immunity. And the stories they've been telling you are lies, and the small amount of published science is contrived. And I would say I'm ashamed of the scientists to put together, literally contrived situations. They're always using antibodies and never using the virus. They use pseudovirus and engineered cells, and then they perform some really ridiculous maneuver, and they can show that one particular kind of antibody doesn't bind as well, and say, oh, look, escape from immunity. I just think that's just BS. That's not how immunity to viruses work. Antibodies are useful. I'd rather have them than not have them. But I tell you, if you had to settle for one thing, it would be T-cell immunity. And if you look at the T-cell immunity, there is no question that a 0.3% variation cannot possibly produce any situation where someone who's immune from surviving natural infection or through vaccination, not one of them is going to none of the variants are going to produce illness. It's not possible. So it's one of these things that's so astonishing that it's very frustrating for me as a scientist to hear advisors and government ministers discussing with the media, and they're all hand-wringing about the variants. And I just feel like shouting at the screen, you're lying, because I understand how this works. And both theoretically and empirically, it's not possible. So there's theoretically such a small difference between the most distant variant and the original are so close together. I call them samians, samians, just to be sarcastic. They're really not, they're not different enough to worry about. But it's not just theoretically. I think, Dale, you showed one of the papers where, again, another group, American immunologists, again, I think they were ahead of the game, and they found some people who'd been infected by one variant or other. They asked them to donate cells, they did, and they challenged those cells with every variant that they had, or peptides from every one of the variants they have. And sure enough, the T cells responded to every single variant that they had. That's the one. Yeah. That's the one. Whoever these people are, they are national heroes. I don't know any of them because they're working in viral immunology, and I worked in immunology of chronic diseases like COPD and allergy, and it's a different thing. But I think they have been doing a stalwart service for the nation, because they've been teeing up stuff that I needed to know in order to be able to talk to you the way I have tonight.
All right,
So,
let me jump in here
yeah,
because I mean,
so
obviously you've laid it
probably
out.
yeah,
Yeah, those are.
that's it.
I mean, it's incredible. It's clear. We've covered different versions, which I've been looking forward to having you on the show because many of the times you would put this information out and we'd go find the proof that you were talking about and present it on the show. Here's my question that I think that many of us have is, we keep hearing you saying, and I was just shouting at my television, how is it? I mean, what was the process at the point where you realized, wait a minute, they got this wrong? You must know some of these people, right? I mean, did you make phone calls? Were you calling people you knew in departments you'd worked in? And do you have any peers that are listening? Like, how is it that someone like you isn't being heard at a critical time where we're in the middle of a pandemic like this?
Yeah, it was very frustrating. Do you know, I didn't. In retrospect, I should have actually, laid a call to Whitehall in London and said I'd like to have a teleconference with Sir Patrick Vallance. But I did start writing articles to say, and I was very polite. I just pointed out that there are some mistakes here, and so this is the thing. I think they counted, whoever's doing this, and we can talk about this. They counted on us behaving in a particular way. So people like me, the scientific method. If you disagree with someone and you think if you think they're actually going further than the data and actually lying or exaggerating, you don't tend to use that phrase. You'll say, "Oh, I think you might be mistaken," or maybe that's just a difference of view. These are the sort of diplomatic speak that we use. We don't. So if you think someone's actually lying, you don't tend to do that. And I think they counted on it. So yes, I started hooking up with pathologists, other doctors, and we did start writing articles together, trying to get on TV. I wrote to every one of the TV stations and the radio stations and several newspapers saying I'm available for interview. Can I help you at all? And I did get interviewed by one of the what we call a tabloid papers, cheap paper, and they did have at least two of my articles in there. I think one of them was what SAGE got wrong. So SAGE is the Strategic Advisory Group for Emergencies for the British government. And I at that time, I was sure of three things they'd got wrong. If I'd thought all of them were wrong, I would have said, that they're lying, but they would never have published that. Every single no TV or radio would talk to me. They literally didn't get back to me at all, which is just absurd. I'm not used to doing this, by the way. I'm a very private person. I've never publicly campaigned for anything environmental or pharmaceutical or anything. I'm not sure I've said anything public that wasn't to do with my job ever. So for me to do this, people to accuse me of being, an anti-vaxxer or whatever, it's just absurd. I've spent 32 years in the industry, and I'll give a shout out for Pfizer. I love working for Pfizer. I had fantastic colleagues who did good work together, but I don't recognise what they're doing now, or Moderna, or Johnson & Johnson, or BioNTech and I don't know. I don't recognise the products of the vaccine, so-called vaccine, these gene-based vaccines. I don't recognise what they're doing. It absolutely is nothing like the kind of work we ever did before. We would not, in research, have allowed what has happened. In research, I was well aware in the industry that there were basically people who would do wrong things in the commercial division. They would make claims that were not entirely supported by clinical data, and every now and again they'd be slapped down and there would be a fine. I wouldn't say I'm happy with it, but I kind of knew that it was a knock them down, drag them out kind of commercial fight. Yeah. But in research, it only ever once happened to me in 32 years that I came across someone deliberately trying to pass data off, and it was literally not even close to the clinic. That's the only time it ever happened in my entire life. We're honourable people in research, so we should turn, I think, to vaccines, don't you think, Del? Because I just don't understand how any of the scientists involved in what they're doing can sleep at night. And you can either ask me questions or let me speak.
Go ahead.
Okay.
Yeah.
So my PhD was in respiratory pharmacology, and that's how I got into allergy and respiratory. But prior to that, I did biochemistry and toxicology. And at the time, I was thinking maybe I would like to work in a hospital. I could be, in clinical chemistry, things like that, or for the forensic service. And I did actually briefly work for the forensic service, trying to work out when people have been poisoned or have died of an industrial accident, what's happened. So it meant I studied what's called mechanisms of toxicity, and I studied under the best professors who'd invented the whole field when we started to realize that chemicals can injure you, and when they do that, it's not random. There often will be a transformation, a chemical transformation, and that can lead to what's called the ultimate toxin, and that's what injures you. That's how smoking causes cancer. It's how weed killer poisons you. There are all these clever, separate mechanisms of toxicity, and they are as worth studying as pharmacology, which is the experimental basis of therapeutics. How is it that drugs work? So this is like the dark side, so mechanisms of toxicity. I studied that, and I could have been a toxicologist. So when I look at the gene-based vaccines, I remember looking, even though vaccinology is not my specialism, but I'm able to read into new areas. I changed from a respiratory guy for all of my career to a dermatologist when I ran Ziarco, and I managed to raise $50 million US and run a trial and sell the company for a lot of money. So I was able to read into a new area. That's what I do. So my toxicology experience came into its strengths here. If you look at the design of these vaccines, every single one of them contains a genetic code for the spike protein, the virus spike protein, the little spike that you see on the cartoon picture of the virus. So when I remember thinking, well, I can see why they've picked it. It's on the outside. Maybe you'll make antibodies. The antibodies will recognize the virus. Yeah. So I went to start doing a Google Scholar literature search because I don't have access to library facilities. I'm retired. And within 5 minutes, I'd found 3 papers that worried the hell out of me. Spike protein from the 2003 SARS. If you give it to animals intravenously, it causes blood clots. If you add the spike protein from SARS-CoV-2 to bits of the human immune system in a test tube, you can activate a system called complement, which is what can lead to the cytokine storm. And I remember I was sitting there, I was absolutely horrified. I thought, so you've put in this vaccine something that's going to make the person's body make a copy of this spike protein. And I was thinking, well, I just tried, I couldn't really work it out. And I thought, I must have missed something. I thought I must be wrong here. Basically, this system is going to make a toxin appear inside the recipient's body. And I think I wandered around for a few days and I thought, I must have this wrong. I must have this wrong. Maybe they're going to edit the spike protein so it no longer has the biological properties I've described. But after a while, I realized they hadn't. And around that time, I bumped into online a German Thai physician called Dr. Sucharit Bhakti.
Yes.
You might have seen Sucharit Bhakti.
Yep.
That's the guy. And so we were on the phone. I think it was maybe November. So none of the vaccines had been approved at that point. And anyway, we'd had a really long call, and we'd unfortunately both concluded the same thing, that all of these vaccines will cause the recipient's body to manufacture all or part of the spike protein. And both of us thought, there's no way it'll stay in the injection site, because that was what they were saying in the dossiers. We'd read right. Part of the Pfizer dossiers, and that's what they said. And we thought, don't be silly, that the muscle of your shoulder is highly vascularized, it's full of blood, that's why it can work as a muscle. Some of it's going to leave, and therefore it'll end up producing spike protein in other parts of the body, could potentially be floating around in the blood, or maybe being manufactured by the cells that line your blood vessels. And so he and we thought it's certain some people are going to get blood clots. That was our determination. And that goes right back to the poor Romney family that you just had on. So I knew with a certainty, it's what I do for a living. My job was to make patterns out of faint data before other people. I would look at all the data and think hard. When have I seen relationships, cogs and gears, things that relate to each other, and come up with a story that probably reflects reality, and to be there before my competition, because I would be trying to make a new drug, or in this case, to try and spot the danger that could occur before other people. And Dr. Bhakti was the same kind of mindset. And so And also Dr. Wolfgang Wodarg was another
Yeah.
guy. And I think it was Dr. Wodarg actually, rather than me. He drafted a petition and asked me, would I be a co-signatory? And so I said yes, and we worked on it for a few days. And we sent that to the European Medicines Agency, and I remember it very well. It was the 1st of December 2020. And I knew this. I knew the first vaccine was going to get, I knew by now that we were not being treated like adults. We were not being given honest information. I knew the regulator was going to approve it, and I was frightened that it was going to kill people. As a toxicologist, I knew what was going to happen, so it's quite upsetting. It's quite upsetting.
So to watch this being rushed
Yeah.
through, and
Yes.
what I said is, we looked at the animal trials and we saw antibody-dependent enhancement. We saw all sorts of issues there. Couldn't
Right.
find any human trials really over the decade at Moderna or all these discussions of mRNA. So it appeared that these were going to be the first human trials. And one of the things that I found disturbing is, I know Donald Trump brags a lot about, like, I poured billions of dollars, we made this vaccine. Billions came in from nations all around the world, but I didn't see any adjustment in the product. I mean, other than they just decided, what dosage level, but there wasn't like, Moderna had been failing to make a product that anyone would buy for over a decade. mRNA has been a failure for over a decade, haven't produced
Yes.
a single product anyone can use. And then all of a sudden, we pour billions of dollars in, we start manufacturing them before the trials even starts because we're so sure it's going to work when it never had before. The whole thing just seemed to be such an incredible recipe of
Very
disaster,
suspicious. Very
But did anything
suspicious.
change? The technology never changed. Am I wrong? I didn't see any change in
No,
technology
you're
that
not
it
wrong.
failed.
You're not. So here's another thing. I'm not an expert in molecular biology. I'm not. I would say I'm a classical pharmacologist. But what I did do when I was vice president, I hired molecular biologists. I love people who are skilled in different areas. The medicinal chemists used to joke they liked talking to Mike Yeadon because when they described their work, I said, "Oh my God! Every day you have to come in and invent and manufacture a chemical molecule that's never existed in the history of the universe." And they go, "Yeah, the guy gets it. That's what medicinal chemists do." And so I really loved it. And the same with molecular biologists. And they described how they would join genes or clone and express things or measure their presence. I would try and play it back to check I've understood it and really enthuse about their topic. So I had some really good molecular biologists. And so we had been using mRNA as a laboratory tool when I left Pfizer. So that was 10 years ago and earlier than that. And at the time, I would say we were not within a country mile of having a medicine you could give to every man, woman, and child. And I've looked at the literature over the last 10 years, and there have been some important advances in some areas, but not across the board. We've not solved all of the problems that we had even then as laboratory tools. What were the problems? You would make a sequence and you would try and bind to its pair inside a cell and basically turn it off. It's called knockdown. You can do that, but it's really difficult, and that's because the messenger RNA that you would manufacture to knock down a particular target, this would be trying to understand how health and disease works, and so we could maybe use that learning to maybe develop a new kind of drug. So I was using it as a laboratory tool, not as a medicine.
Right.
But one of the problems was the stuff was just too unstable. You'd manufacture it, you'd add it to your cells and culture or an animal, and it would break down, at the speed of light. And I know that one of the changes that's occurred over the last decade is people have worked out that they can chemically modify the RNA and the mRNA to make it more stable. So I reckon a lot of people don't know what I'm about to tell you. So when these gene-based vaccines are given to you, and they contain at least two of them, the Pfizer BioNTech and the Moderna, they contain mRNA. It's not like your mRNA or my mRNA. It's a foreign chemical. They've actually chemically modified, I think it's pseudouracil, and they had to modify it, and it's non-natural. And if they didn't, your enzymes, the things that break things down, would destroy it in minutes. So they've basically given you a non-natural version of part of the message, and you probably didn't know that. And I think they should have been required to do toxicology on it. No one's ever done toxicology on that particular modified chemical, and I just couldn't believe that the regulators were letting them do a trial of, I don't know what it was, 40,000 people, but I thought, you haven't done the basics. How do you know that the actual chemicals aren't going to be toxic? And then here's the other thing that really upset me, that because I'm a pharmacologist, I would want to understand, when you administer a substance to a person or an animal, I want to know, where does it distribute to in the body? Where does it go? That's called, and then how long does it stay around there? That's called pharmacokinetics. It's like drugs and speed and movement, pharmacokinetics. But also, you want to know, what does it do when it's there? That's called pharmacodynamics. So pharmacokinetics, moving around, pharmacodynamics, what does it do? Vaccine manufacturers are not required to do pharmacokinetics or dynamics. So they didn't study where the vaccine went after it was injected in your arm, and they didn't have to study where it produced the spike protein, how much, how long. They did not need to study them. And I remember I was almost in tears reading this dossier, because I thought, you've no idea what's going to happen when you hit the people. And I tell you what, God and nature is never that kind. If you produce a new intervention, like, I don't know, it's like stabbing a big screwdriver through the block of your V8 engine. Yes, there is a slight, tiny possibility you will produce an adaptation that will increase the power, but most likely you're going to destroy it. And if you throw a brand new chemical into a human being and you haven't worked out where it goes and what it does and how long, the chances that you're going to get away with a clean profile, nada. It's just not going to happen. Life, nature, God is never that kind. And so I knew that when I looked through this dossier, they had no kinetics, no dynamics. And I'll tell you what we've later found. So again, I with Dr. Vaxxed, Dr. Vodag, and Dr. Frost and others, we've written a series of open letters to the European Medicines Agency under a label called Doctors for, that's the number 4, Doctors for COVID Ethics. And because I'd been in small company, the small company world, when you're an entrepreneur, you have to do everything from emptying the dustbin to working out what a press release is. If you're in a big company, you may not know what a press release is, but I had to work out what a press release was. And you contact newswire services, and they will release for money your one page or whatever it is, and they'll send it to maybe 4,000 news gathering organizations around the world. Mm-hmm. And because I'd done this before, I said we should use a professional newswire, because that way our letters will get to every news station from Bogota to Brazil to Birmingham. So we did that, and you were the only people that picked it up. Literally, the only one, I think, was the Highwire, maybe one other. Oh yes, Children's Health Defence.
Yeah.
But we sent it to 3,998 other news gathering organizations, including whichever country you're in, France, Germany, UK, America. Every one of your national broadcasters got a copy of this, and all the news gathering organizations in your country got a copy of this, because I sent it out using a commercial newswire, and that's how it works. That's how we would get, when I was in Ziarco, we wanted to make an announcement, we'd raise some money, or we'd had a good we start a clinical trial. That's the way you get known in the ecosystem. You go to a biotech newswire service, and they know to send it to every organization or person that gathers information in your sector. That's how you get known. And so what we did is we went through the sort of healthcare and news gathering organizations. So that frightened me. So we knew that there was going to be, we were as sure as we could be as toxicologists and doctors that these gene-based vaccines will cause the expression of spike protein. We knew that the manufacturers had not studied where. My experience as a toxicologist told me that it won't stay in the arm. Some of it, you should measure how much, will leave that site. And I'm afraid, I was sure that some people would get blood clots. I'll just quickly describe why these are the most dangerous vaccines ever. Okay. And all the people giving you puff pieces about how this is going to be the future of vaccines, you really should watch out. Normally, when you get given a vaccine, and I'm very positive about innovative new medicines, that's where I've spent my life, it's where I've made my money. But I'm very pro-safety. If there's anything that is a safety risk, it's got to be looked at. You can't live with yourself if you don't. So, a normal vaccine, you take a piece of the dead infectious organism, a dead pathogen, and you mix it with some stuff that will make your body wake up and recognize that it's facing a foe, and you inject it. So there's really only one thing, and it sort of goes around the lymph system in your body. It gets presented to the immune system. That's not how these gene-based vaccines work. They are a multi-step thing. If you think about like an Apollo rocket. So first you inject the code, then the code has got to get to a tissue, then it's got to be taken up into the tissue, then it's got to be copied from the mRNA into spike protein, and then the spike protein has got to be expressed by your cell or released from the cell and get to the immune system. That's 4 or 5 steps, Del. And because they have not measured them, every one of those steps will be subject to what I would call normal variation. May not be a bell curve, but normal variation from low through medium to high. In every one of those steps, I'm certain that's true. They're not digital. Every one of those steps will occur either well, badly, moderately, or well in each of those steps. So if you take 20,000 people, one person would probably have very little of the vaccine taken up and very little of it expressed and in the wrong place and not really tickle your immune system very much. Now look at the person on the other end. They've got loads of the vaccine taken up in large quantities, expressed at high amounts in a dangerous part of your body. And I think that's why some people are fine and other people die of brain blood clots. I think that I've just described. I would call it a tail risk cubed. It's tail risk cubed. Where does the vaccine go? How well is it taken up? How strongly is it expressed? Every one of those is subject to variation. You imagine tail risk, the highest amount, the greatest expression in the worst, most vulnerable part of your body. I think that's the explanation. And I think if you carry on making vaccines using this design, you might be okay with the next one. Just don't express something that's poisonous, but you will always have much greater variability. I swear that you will always have much greater variability because you'll have tail risk cubed, just the whole way it works. So yeah, I'm not that impressed. I never thought mRNA was ready for prime time. 10 years ago, when I was in the industry, they were laboratory but difficult to work with. So the idea that we've made, all these jumps to safety in 10 years, that really isn't how it works. So somebody's is much out. So that's where we are. Oh yes.
Let me get specific with you let's because we could obviously, and we'll bring you back on. We'll get into more details too. And there's already so much. I think my audience is just, you're so clearly laying out so many different issues. It's we're all going to have to take a deep breath and try and come to an understanding of how the world let this happen. But I want to get specific for a second because it's an interaction that just happened over the last couple of days between you and I think that you looked into it. One of the things that we reported on, it might have been, many months ago now, was you were talking about that you were very concerned of this syncytin issue, this outer layer of the placenta that, as you and Dr. Vidarg had written, I think, to your health agency, I believe it was to Pfizer. I forget, one of them, right?
No,
saying
it was to the EMA, the European Medicines Agency. Yeah.
That you were concerned that the spike protein looked to have a sort of a similar genetic structure to syncytin, enough that there could be a mistake made by antibodies where they could attack the syncytin. And I asked you the other day, where are you at with that? You said, well, nobody's disproven that idea, but it's not the hill you're going to die on. You have so many of these other things you can prove, and you've sort of let that go. But we had just seen a study that obviously took you seriously enough, and there was enough concern around the world about it. This study right here, addressing anti-syncytin antibody levels in fertility and breastfeeding concerns following the COVID-19 mRNA vaccination. Now, this study states at the top, essentially, that its goal was to stop the concern about, this potential problem, that it didn't want to, vaccine hesitancy is an issue. So I find it concerning when a study that is supposed to be challenging idea gives you its bias right up front. We're going to spend this time to disprove this notion. Now, you had sort of stepped away from it, but this study was brought to our attention by another scientist that said they're saying they're not seeing, the conclusion is that the antibody didn't bind to the syncytin, therefore there's no issue. And yet this scientist said to us, Del, it looks like we're seeing binding in the body of this study. I sent that to you, I believe it was yesterday. You had a chance to look at it. So in real time, we haven't rehearsed this. I don't know what you're about to say. When you read that study, you came up with sort of the original hypothesis. You're willing to accept that, it was a hypothesis. But now this study goes to disprove this hypothesis. What did you see in that study yourself when you looked at it? Was it properly done?
Yes. So just as you say, just to recap, Syncytin-1 is very similar to spike. They're in the same family. Interestingly, when you look at them structurally, they are similar, but they're not very similar to sequence level. So when we put it in this petition, a lot of people attacked me. I mean, really violently, unpleasantly on Twitter. You're an idiot. That there are not enough sequence similarities. It's not possible. Because they are family similar that would look to the immune system like they are the same. And so that I think the risk isn't very high. Sorry, the probability isn't very high, but the impact if it occurs is devastating because it could lead to children. So this study. They said, well, in order to reduce vaccine hesitancy, we're going to try and measure, basically show that this binding doesn't occur. And I was really upset. I'm sorry, I don't know about the dozen or 15 authors, but part of the conclusion is we didn't see binding to syncytin. But I don't know whether your technical people, Del, can show the figure 2 to the audience. Is that possible? Yes. Yes, so I'm right across that. I'm just going to have to move it. I can't see. Yes, so if you look on the right-hand side, that's the anti-syncytin. If you compare the far left group of dots, day 0, and then the 1 to 4 days, you don't need to be a rocket scientist to believe that the 1 to 4 days, almost every one of those blue dots is higher than all the blue dots to the left in day 0. Okay, now don't be distracted by the line at the top, which is positive. It's completely arbitrary. I looked through the paper twice and the authors have no basis for drawing the line there. None at all. None at all. And so I'm asking, is there an increase in signal? Because if there is, there's some binding. There's some materials that are being raised by the person after vaccination that's binding syncytin-1. There it is, after 4 days. Now look to the left panel. SARS-CoV-2 antibodies. So has the person generated an antibody to SARS-CoV-2 between day 0 and day 4? It's slightly rising. It's not very strong, is it? So and then look again at the pair on the right, day 0, day 1 to 4. I put it to you and anyone reading this that the most prominent early effect after vaccination is they're raising antibodies to syncytin-1, even before they've raised it to the virus spike. So I don't know whether I'll say I do not know whether that will have a physiological effect. But I would tell you what I would do today. I would contraindicate vaccination of pregnant women. I would never have given this to them. We've never done this before in history. We've never done this. A new kind of medical intervention with no reproductive toxicology, and that we've gone and given it to hundreds of thousands of pregnant women. It's the height of reckless endangerment, isn't it? They're not, and also by virtue of being able to bear children, the people they're vaccinating generally, young and healthy. Young and healthy people don't get COVID-19 and die. And so we've done two wrong things. We've given the vaccine to people who are generally not at risk of the disease, and we've given them to people who are in a position of, we would normally have held in extreme vulnerability. They're growing a child. We never, ever, ever do this. The last time we did this was thalidomide in the late 50s, early 60s, when my mother was bearing me. And I was fine, and I know some people of exactly the same age with one limb missing. So I don't know. I don't know in what world it made sense for regulators or nurses or doctors to do this. So I've written
So
this
let's
down
just
when I
talk
was
about
listening.
let's just drill down on that
Yeah,
before we get too far away from that
yeah,
study.
okay,
If the antibody, sort of take me through just very quickly through your hypothesis.
yeah,
Syncytin is this outer layer of the placenta. Really, it's of
yeah,
viral DNA nature, right? When you say they're in this little sort of
yeah,
same family, and
same family.
so if the antibody that goes after spike protein, the vaccine is designed to say attack this anytime you see it. Create antibodies that
Mm.
attack spike protein, and your concern was that if this syncytin, if it develops something that looks like it might attack the syncytin, then your antibodies that you've developed from this vaccine are going to attack the outer layer of your placenta, and
Yeah.
therefore either make it difficult for you to develop one or to keep one that's in your body. And what you're seeing there, I just want to be clear, day 1 to 4, you're seeing binding. Now, you said that may not lead to the destruction of the placenta, but we can say that their conclusion that there was no binding is essentially a lie at the end of this paper, right?
Yeah.
That we can
Right,
say is they did
yeah.
not prove their conclusion. In fact, the proof seems to be the opposite of what they concluded in this
Yes,
paper.
I'm afraid so. So yes, so I hope it doesn't lead to abortions or prevention of pregnancy. But yes, as you're right to ask me. Basically, the worry was that if you prompt the human body to make an immune response to not just spike protein, but to related structures that you need in your health, then the possibility would be of an autoimmune disease that could give rise to, in this case, a difficulty with pregnancy. So that was the concern, and it was in the petition. And I never thought it was a high probability because, as people told me, insultingly, they said the similarity is really weak. And I said, sure, it's weak, but it is there. Don't you think it's beholden then on the manufacturers to do the experiment that you and I have just recapped? And they never did it until a year after. And then when they've done it, there's some sign of binding. So I would do the things I said. This is why you do toxicology first and then clinical trials.
Right.
You don't do clinical trials and then when you find toxicity, work out why that was. I mean, that's just reckless. That's what they've done. And I was going to say I was moved by your previous item, and I wrote it down. The premise of vaccines. The premise of vaccines is a person turns up fit and well, and they receive an intervention that's designed to keep them fit, healthy, and well. What have we done? We've taken healthy people and we've given them an intervention that has, in the case of that young man, I think it's quite likely. I've even described the mechanism of blood clots. So we've almost certainly harmed this person. And now we've just been discussing another one where we're causing a generation in a woman's body of antibodies against a part of her own placental supporting structure. It's just, and I wanted to point out one other thing we had in the petition. Another thing we pointed out in the petition was that some of the vaccines were using a chemical called polyethylene glycol. It's quite a common chemical. It can be used in makeup and manufacturing. But what you don't do generally is inject it into people. And a small amount of it was present as part of the lipid nanoparticles that surround the mRNA vaccines. They're using this polyethylene glycol. And it turns out quite a few people are allergic to PEG. And the risk was that if you injected it into people, some people would have an anaphylactic or an anaphylactoid response and could die. Guess what? In my country, the very first day they started vaccinating, they had 2 healthcare workers went into severe anaphylactoid reactions and had to be rescued with adrenaline jabs the first day. And if we look on your VAERS system, there are thousands and thousands of people who've had acute anaphylactoid responses. So I'm just pointing this out. I'm than I am, or more stupid than I occasionally am. We were right, Dr. Vodarg and I, about polyethylene glycol. We warned that it could give rise to allergy, to anaphylaxis. That's exactly what happened in the very first day, and it's still happening. You can see it on VAERS. We then, secondly, were worried about syncytin 1. And the first bit of science, first bit of clinical data that's come out says we were right to be worried. There is now a concern to be worked through. one way or another. And then the other thing we said is that basically these are brand new technology and anything could happen. There is no long-term safety. So now, do you think Yeadon and Vodag, would you put money on these two people or would you put it on the liars? Because so far the liars have been wrong every time. So this is why I'm fearful that it's not the end of this yet. And you mentioned antibody-dependent enhancement. I can't work out whether it's likely or unlikely. So it's kind of in the same category as the syncytin. If it occurs, it could be devastating. It literally could lead to an enormous number of deaths. I know some doctors are predicting that, and I would say I am as worried as they are. But I don't feel able to assess how likely it is to occur, and I've got plenty of meat to talk about anyway. So the fact that I haven't gone on about antibody-dependent enhancement does not mean I take a different view than others that are strident about it. It's that I've got plenty to talk about, and I can't assess whether it's a high risk or a low risk. But why have we got ourselves into the position where we've vaccinated, 80% of the population in Britain, or I think it's 75% of the population in Britain, and we've got no long-term safety? What happens if something bad happens, Dale?
I know.
People seem to lack the imagination that bad things do happen. Some of them we predicted, and then they've come true. And it makes you think: is someone trying to kill large numbers of people? And I'm afraid I've come to the conclusion that the only thing that ties every single one of the major observations is that whoever has organised the lies has as an objective ultimately to lead to large numbers of deaths. And I'm going to just mention just a few sentences why that fits and nothing else. All the things I've described, that I call them the lies of the narrative. We never would have used any of those things in 2018 or 2015. All of them have been invented all at once and then spread around the world in 2020. But it's not just my government in the UK or their advisors that have got it wrong. Because let's say it was one or two people and they got their story wrong. But it's the same lies at the same time by every government that I can find out all at the same time. And so I'm afraid if someone would like to suggest to me the coincidence that could have led to that instantly, I'll try not to grin while you explain it to me. I mean, give me a break. The only way 7 or 8 points, narrative points that are lies, by the way, and scientifically proven to be not correct, could appear in the broadcasts of Germany, France, Italy, Switzerland, Austria, UK, USA, Scandinavian countries, all at the same time, when they'd never been used before and were never part of the pandemic preparedness plans of any nations. If someone would like to suggest to me how that is not unequivocal evidence of at least international cooperation at supra-governmental level, right? So you start by that observation that in February, March 2020, there was already a plan to deceive you, right? That's true. And then a whole bunch of stupid things has happened with the vaccines, and we've gone through several of them, and we're not at the end of it yet. But here's one of the things that was very upsetting with the Romney story, that the family, I think, went to get vaccinated, not because they were frightened of SARS-CoV-2 or getting COVID. They looked like a pretty fit family to me, not the kind of people who were typical victims of this virus. The reason they got it is they'd been told you're going to need vaccine passports to travel or to go to university or to maybe go to a sports ground. And when I say to people, when your government is doing something that's A, stupid, and B, illegal, you've got two choices. One, you can go along with it, and the other is to stand up and fight it. So it's stupid. If I'm a vulnerable person and I could get this disease and die, and I'm vaccinated, and let's say I don't get any side effects, I'm now protected. I don't need to know, Del, whether you have been vaccinated or my wife has been vaccinated. I've got my protective coat now. My immune system has been primed. If I happen to breathe in that virus, I will destroy it. So who is it then that needs to show their vaccine passport, this electronic record? The people who want you to have it are people like Blair and Gates and other people. Blair left office in disgrace, and lots of people think he's a war criminal. And I'm afraid I think he hasn't stopped at being a criminal of war. It's just completely ridiculous. Blair is a lawyer and a politician. I'm a scientist. I am absolutely certain no one will benefit at all from vaccine passports. It doesn't make people safe, Dell. It doesn't mean you can't carry the virus from one person to another. You learn. No one seems to have asked the question. Back to your point about blaming the media. It's appalling that the media have not even asked themselves, what is it about this passport system that they're going to make people safe? Because once you start asking that question, you realise the answer is it doesn't work. It's a stupid idea. It is a stupid idea. But so that's one thing. But to suggest that that young man could not go to a chosen university unless he was vaccinated, that's illegal. That's called coercion. You're not allowed to coerce people to take medical procedures, especially experimental medical procedures. It's explicitly prevented by the Nuremberg Code. To coerce someone to take an experimental medical procedure is illegal under international law. All our countries have signed up to it, and I've checked, and the UK is still a signatory to this particular pact. But that's what they're doing. They're suggesting that kids have got to be jabbed before they go back to school, pregnant women given this vaccine. I, as a toxicologist and a drug discoverer, we knew it was wrong before they even approved it. And we predicted 3 kinds of toxicity, all of which occurred. So it's not like it's obvious that was what was going to occur. But and here's what I think. I'll just cut to the chase. And I would say to people, well, one, don't get vaccinated with these COVID-19 vaccines. I don't think they're safe enough. I wouldn't. All the other vaccines, I'm on the wrong show. But anyway, don't take the COVID-19 vaccines.
It's all right. No, the people are going to have to tell their friends.
Absolutely. But in terms of vaccine passports, I cannot think of a political battle that's more important in my entire 61 years than preventing this system coming into being. And here's the reason. If we allow ourselves to be fooled that by carrying a little app on our phone that says, Mike, you've been vaccinated, and that means you can cross a regulated threshold, let's call it a regulated threshold. What we will be allowing, what we'll be bringing into being is the world's first common format digital ID with an editable health flag and this whole system would be interoperable from anywhere in the world. Birmingham, Alabama, Birmingham, Midlands, UK. So you could present your credentials, and if the algorithm judges you're the right person, you've been vaccinated, it might open a door or allow you to pass an international border. But there's no limit to what you could be prevented from doing. So if Visa and MasterCard got together and said, before the contactless system will open for your card, you have to present a vaccine passport. I don't know, 7 lines of code, it will be done. And what I think will happen is if the vaccine passport system goes into being, whoever operates that database and the algorithm has complete control over you. If you want to cross what I will call a regulated threshold, it could be the entrance to a large store, an aircraft, going onto a campus, but it could be a gas station. It could be using your contactless card. Any regulated threshold or transaction, whoever has control of that database has control of you. And if they decide you are not allowed to do something, then you're prevented and there's nothing you can do about it because all the peers around you are operating and beeping in and you've no choice. Now here's where this is what I think is possible. And it's not a plot from a sci-fi novel. I think the whole point of the pandemic and the lies and the vaccines was to get you to electronic digital ID. Once that system's up and running, and we've already been told about this, Dale, haven't we, about variants, which are a lie, you might have to have booster shots, they've said. And I know you don't need booster shots, so I'm terrified of booster shots because they're not vaccines, and yet they're being manufactured. At least one of them, Moderna, has said that we are bottling 1 billion doses of booster shots. And when I heard that, I actually felt real fear because I thought, it's not a vaccine in there, is it? They're already vaccinated, and I've checked, and the immunology shows that there is not enough antigenic drift for you to need to give them additional vaccine. So what I'm worried is that the vaccine passport, it'll ping, Dr. Yeadon, go to your nearest vaccination centre in the next 2 weeks to receive your 3rd vaccine. And there'll be a note at the bottom. if you don't comply, your vaccine passport will become invalid. And I've just described a world in which you won't be able to move around, use your bank card, buy gas, enter a store. So I'm not saying that's what's going to happen, but I'm saying it could happen. And there's already enough evidence that there are some very bad actors around. So if we allow our citizens, if we allow this system to come into being, I think it will be misused for exactly the purpose I've described. Now, so at the very least, we'll be giving up control to a machine, a database, whoever operates it. What if what's in those vaccines, the third one and the fourth one and the fifth one, is a gene sequence designed to kill you? I don't know, it's not my crime. But if I wanted to set up a system where I could have complete control and with plausible deniability administer over months to years to billions of people something that would injure them and kill them, I couldn't think of a better plot than this one. And what I would say is, if people think that I've completely lost my mind, then break the logic. Tell me where I've misspoken. Tell me, because otherwise you're relying on people aren't that evil. And I'm afraid there are evil people. There have always been. Look at Pol Pot, look at Nazis, look at Stalin, look at Argentina in the 70s. There are people everywhere over time who have been willing to kill other people to get their way. And all I'm suggesting is that's what's happening now. And the only difference is it's technology rather than weapons. And the only other difference is the internet has allowed it to involve pretty much every breathing person on the planet. But other than that, it's the same grubby, revolting people with criminal minds. It's just, it's the same as Cain and Abel, really. So I think there are bad people who want to do bad things, and I think they've invented a system that will allow that to happen. And even if you believe what the government's told you, given what I've just described about the vaccine passports, for goodness sake, make sure that you do it on pieces of paste, on paper or pieces of cardboard. Don't use a digital database, because once that exists, it can be used to control people, including to get people to turn up to be injected with materials that they can't be vaccines. Immunologists will tell you they can't be vaccines. So what are they? I don't know. But that's probably where I should stop, because I do get the strong feeling that the work I'm doing in speaking out, at first I thought it was a technical matter. Last year it was a technical matter. And then I realized that, well, it's more than technical, isn't it? My God, when has the government ever deliberately damaged its own economy? And I thought, well, it's the Great Reset, financial reset. Maybe it is. But I'm afraid now when we got through the turn of the year and then all the harms from the vaccines, that's when I decided, I'm not a religious person, but I decided I was looking into the face of evil. I can imagine someone stealing or committing a fraud. This happens, or burgling a house. I don't know that that's evil. It's just, bad people do bad things. This plan did not take 5 minutes. And in order to put it into place, you have to do so many things that result in avoidable deaths. Lots of people have signed off, for example, to pretend that there are not safe and effective medicines. People will have had to have agreed to these things, knowing that would deprive sick people of things that would save their lives. And I put it to you and your audience that once a man or a woman is willing to sign an order or give a verbal order that they know will result in the deaths of, say, 20,000 people, I put it to you that you've already decided you're a mass murderer, and it doesn't really matter whether there are 5 zeros or 7 zeros or 9 zeros after the death burden. And that's why I think it actually isn't anything like the stretch that those who are hearing this for the first time probably think I'm absolutely raving. But I'm as calm as I've ever been. We've been lied to about the severity of the virus. It's not that bad. We've had hidden from us effective medicines. There are loads of points about the narrative that are clearly not true, like lockdowns and masks. Mm-hmm. The narrative of variants is also not true. So even if the vaccines so far were safe, you are being misled, I think, really to the gates of hell by this variant story, because people do expect, I've spoken to people who expect, they've had double jabs, they're expecting a top up, and they'll go. And so unless I'm completely wrong and there's an innocent explanation, here's the other test. Is there a benign explanation for all of this? if someone like to write in, I've asked this in 10 interviews, not a single person has made a suggestion. Not a single person. There is no benign, innocent, benign explanation for what's gone on. So I might be wrong in the conclusions. It's not my crime, but I'm not wrong in that this is misleading and it's deliberate and it's hurting people. Now, here's the magic, though, and your show should be part of it, and it's why I'm trying to do an interview every day. Is there's actually not much to be frightened of, virus-wise. The thing to be terrified of is your government.
Yeah.
And the thing I love about the States, I used to visit a lot. I like the fact that you've got a written constitution, so we don't have any formal rights in the UK. I think you've got some in writing that you can enforce in courts. And also you've got, I'm not sure I've described this right, is it the federal system where different states can do different things? They have, subsidiarity.
Yeah, we have
a lot of
our powers in the states.
Exactly.
Yeah, it's different.
Exactly. We don't have that. So the central government in Westminster in the UK, well, in England, tells you what to do, and everyone has to do it. And so we are no experiment. So people in England who don't look for alternative news sources think that what they're being told is true. Whereas I've been looking at the Dakotas, I've been looking at Florida, I've been looking at Texas, and so on. And so I celebrate when people have taken their freedoms back. So, but that's the thing. All around the world, don't be frightened of the virus. It's pretty much gone now. But be terrified of your government. You must take back your freedoms. With no more ado, you must take back your freedoms. They're not going to give it back to you because they've not taken it from you legitimately. There was never any need to lock you down. It doesn't work. They've made you wear masks that are frightening. They've told you wrong things about the severity of the virus, deprived you of effective medical treatments, and then exposed you to, I'm afraid, dangerous vaccines. And now I think the coup de grace will be a combination of vaccine passports and then the next step. So take your freedoms back peacefully. I do not encourage anyone to break the law, but the restrictions that are being placed on us, 18 months. I always use this, that the flu takes a few months to go through a country. How is it that people could possibly believe that after 18 months, this bad smell is still circling around, ready to kill people? So you people who are loyal like me and you believe the government and watch the BBC for, I stopped watching them after 41 years last year because it was making me ill. You know that what I'm saying is broadly right. You're being misled. Take your freedoms back tomorrow peacefully and it'll all be over. But if we don't, then I don't know where it's going to end, but not good. I'll take a pause.
Dr. Yeadon, I think I'm going to we'll end it there because I think that is the point. That in the end, you've laid out so clearly the lies, and it's something that the Highwire has worked hard at, but you've done it so succinctly and clearly that there's one video now that people can watch that I can say, here it is, refute this. To any scientist, prove this wrong. And I think you're right. We've got to ask ourselves, these people have allowed themselves to lie. They've allowed themselves to lie and put forward lies that have killed millions of people around the world. As Vladimir Zelenko said, had you just used hydroxychloroquine, we could have saved azithromycin and zinc, the cocktail that's been working all around the world. We could have saved hundreds of thousands of people in America. They want to make us afraid of a virus that killed over 500,000. Is it 6 now in America? I put that on the back of Deborah Birx and Tony Fauci. You killed America by denying the treatments that were available to them. And this probably would have even been less than a bad flu had we actually used the treatments that were available. Those numbers are bad flu with no treatments at all, total denial, complete medical malpractice as far as I'm concerned. I'm with you. There is a reckoning that has to happen. We need crimes against humanity. I believe we do need a new Nuremberg trial, and I hope that you get to be a witness in that. We're going to keep leaning on you. We'll bring you back for other things as we start finding more evidence or have any questions. I want to thank you for being so candid today. I want to thank you for your bravery throughout this to continue to do what's uncomfortable. As you said, they counted on the fact that scientists are nice and won't just call each other liars. They also count on the fact that very very few of them or you have ever gotten into PR, wanted to be in front of cameras. Scientists tend to be people that like to work on their own in small groups of people in a laboratory somewhere. So to get outside of that comfort zone, to come out and try and warn the world as you have of the different issues, and to have the accuracy and sort of, this growing resume of provable facts, and they're being proven throughout time. You are a special person in this world. I believe that you are saving lives, and I do believe that if we all come together, we are going to stop this. We are going to win this, because the truth so far throughout history, though there are dark times, has always prevailed. And so may your words to our audience and our audience's words to the world, and hopefully we're all being watched by something much bigger and inspiring us to our better selves. I want to thank you for taking the time tonight, Dr. Yeadon, for sharing all this information with us.
Thank you for giving me a fantastic platform. I look forward to seeing you again.
All right. You take care.
All right.
If you liked that clip, then be sure to check out our live broadcast of the Highwire every Thursday morning at 11 a.m. Pacific time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.